From last year.
There we go. All right. Well, thank you all for coming, and thank you for making the trip down here in San Diego traffic. I know that's not always fun. Last time Susan presented, it was really about navigating the healthcare system and things people need to know. And now this is more about hiring healthcare. So Susan's going to be covering a lot of topics today. So what we did last time, and it worked out pretty well, was we held questions toward the end. And then we actually stopped the recording at the end, so that way you can ask questions. And if you have something that's a little bit more personal, it's not being broadcasted online. So at the end, we'll stop recording. Feel free to ask any questions that you might have and any clarification items. And Susan will do a much better job introducing herself than I will. So I'll just let her start with it.
Okay,
Thanks,
thank
Susan.
you, Alex. Good afternoon. Thank you for coming out today. I see some familiar faces from last time, so I'm glad that last time was helpful enough that you chose to come back. So thank you. And for the new folks, good to meet you. My name is Susan Baloff. I'm a clinical social worker and a certified geriatric care manager, also known as an aging life care manager, and a certified dementia practitioner. And I am part owner of a business called Windward Life Care. We have been here in San Diego County for 15 years, providing care management, in-home caregivers. We have about 100 employees who are in-home caregivers. And then we also have a home health skilled nursing division. The topic today is hiring in-home care. I have found in my career, which started as a hospital social worker, and then I moved into home care and care management, that many people have questions about the process. How do you find somebody who's a good, reliable, trustworthy caregiver? How do you set them up for success when they come into your home? How do you protect yourself? Because there are people out there who are not good-hearted, who are in this field, although there are many who are wonderful people and drawn to this field because of their compassion and caring. So today we're going to talk about those things. This is our outline. First of all, how do you know if you need help at home or if someone you love is at the point where they need help at home? What do caregivers do exactly? What can you expect when you bring somebody into your home as a caregiver? And then who pays for it? So we'll talk about that. That's often the big question that people have. You know, how am I going to finance this? What's it going to cost daily, monthly, annually? What is the difference between hiring a caregiver privately? And by that, I mean your neighbor had a person who helped them after a surgery. You're going to get her phone number and give her a call, versus working with an agency like Windward. There are many agencies to choose from here in San Diego, so that's the good news for consumers. But what's the difference in terms of cost and in terms of what you're likely to get in terms of service? That will bring us into the definition of home care organization here in the state of California and the Home Care Aid Registry. These are newer developments here in California. In 2016, home care became licensed. Believe it or not, it was not licensed by the state prior to that. So it really was a buyer beware situation. So things have improved. So we'll talk about that. And then ultimately, sadly, we do need to talk about the prevention of elder abuse when we talk about any kind of care that's delivered to older and disabled adults. So we're going to talk about elder abuse. What does that look like? What steps can you take to protect yourself and your loved ones? And ending on a positive note, sort of the flip side of that, going forward, how can I approach this in the way that I'm going to have the best results? And also, it's just going to work well for all involved. Before we go forward, could I ask for some input from you? How many folks in the room have had an in-home caregiving experience, either for yourself or a loved one? Okay. Okay. So more than half of us. I actually am working with a team of in-home caregivers for one of my aging relatives right now and managing that from afar. So I have been doing this kind of work for a long time, but for the past 3 years, I've also been working intimately with the folks caring for my loved ones. So it's definitely given me additional perspective and appreciation for the wonderful people who choose this kind of work. Okay, so let's just start with the context. We are living in an age where older people would prefer to live at home, by and large. Assisted living came to be in the 1980s in the United States. It certainly has grown as a model of care that many people do decide upon ultimately, sometimes for financial reasons, sometimes for other reasons, like they're tired of taking care of their house, or they want to be around other people who have like interests. But this was a study done by ARP a couple of years ago. Their study, and there are many, many of them, but their study found that 76% of Americans over the age of 50 do prefer to live in their own home. And the older people who are living at home, there's a whole lot of them. This survey by Johns Hopkins last year found there were 4.3 million older adults who needed significant assistance with activities of daily living at home. We'll talk about what that means, ADL. But essentially, there's a lot of folks out there like you who are interested in this and really need good information in order to make good choices about getting care at home. How do we know, or how do you know, since you're here today, when is the right time to bring in help for yourself or for someone that you're caring for? And you may think you're going to wake up one day with an epiphany, like today's the day, and sometimes that happens. Frankly, there will sometimes be a crisis, such as a hospitalization, where it will create a sea change, and often it's a healthcare provider saying, now you need to do this. But let's say there isn't a healthcare provider saying that. These are some signs that getting some additional support at home might be a good idea. Falling. Older adults are at very high risk for falling, and we also know that falls can set off a cascade of events that can be very hard to, after a fall, they're found to have a fracture. There's a recovery time, whether they have surgery or not. Oftentimes they'll go to skilled nursing home for rehabilitation. They may experience complications there. When they return home, that would be the time where they would need in-home care. But wouldn't it be great if we could prevent that from happening in the first place, right? So that's one of the things I really encourage you to think about today is taking a proactive stance to getting additional help, not a reactive stance. Because once the fall has happened, it's a long sequence of events that unfortunately for some people don't end up in a return home. If the person you're caring for has dementia or some kind of cognitive impairment, that's another signal that it would be a good time to start doing some research around getting more help at home. Wandering is a tremendous risk for people with Alzheimer's and other dementias. A lot of times I will hear family members say, well, mom hasn't wandered before, so we're good, right? And I always say, well, just logic would tell you there's going to be a first time. It hasn't happened yet, but statistically the chances are quite high. So that's the reason that most healthcare providers will recommend that a person with dementia has someone with them all the time. And so that means if you're the primary caregiver for somebody with cognitive impairment, for your peace of mind and for their safety, it's a good time to get somebody involved. That's the supervision piece. Even if they don't need hands-on help with daily activities, just someone being there to keep that person engaged in purposeful activity and make sure they don't get confused, disoriented, leave the home unaccompanied. One of the biggest predictors for frankly, institutionalization or having a loved one move into a facility. And the research calls it institutionalization, not a great word, but family members can tolerate a lot in terms of helping loved ones because we care for that person and we want to do everything we can for them. But when it comes to providing incontinence care, that is a line that many people have a hard time caring for a parent. So incontinence care is also kind of a flag that if your loved one is needing more help in that area, it might be a good idea to explore who can assist. So you can preserve your relationship with that loved one without going down that path. And then finally, just having respite. I will frequently work with family caregivers who say, I just couldn't take it anymore. I'm so burned out. I think now I need to get a caregiver involved. And I always say, great, that's a good choice. I'm glad that you're, recognizing that. But I'm talking to you right now on other people because we're so stressed out, or it's affecting our job, or, plans, things that we enjoy doing. If the joy has left your life, probably should have brought a caregiver in earlier. So again, that's being proactive, just building in those periods of respite for yourself so that, you can go and get your hair cut. You can go and get a massage. You can go on a weekend away. These are things that we all need to do to sort of fill our bucket so that we can be effective in caregiving as well as other areas of our life. Okay, so what does a caregiver do in the home? What can you expect? We talked about supervision. So when a loved one has cognitive impairment, they can be there to provide that oversight. They can help with activities of daily living. And that means things like getting dressed in the morning, taking a shower, brushing your teeth, combing your hair, getting out of bed, the physical act of getting out of bed, walking. These are all things that caregivers will help with. And for any of you who might have a long-term care policy, they're frequently written that one of the triggers for the policy to go into effect is that the person needs help with 3 activities of daily living. And that needs to be signed off on by a physician. Many policies also have a clause stating that if the policyholder has dementia, and requires supervision, that's another situation where the policy can go into effect. So if you do have a policy or the person you're caring for does, read the fine print on that so you know that, many times the policy can go into effect, but people are kind of waiting for that 3 ADL situation. So, whereas they could have, if they had realized there was the dementia clause, they could have activated it sooner and gotten help sooner. Caregivers provide companionship, go on appointments, errands, fun things like going out to lunch, going to the theater. We've had all kinds of situations. We've had caregivers travel with people. We have a client who enjoys going on train trips. So our caregivers have gone with her to all kinds of really neat places by train. Meal preparation, medication reminders, and light housekeeping. Some things that caregivers typically don't do, certainly if they work with an agency, is that they cannot provide any care that's considered invasive. So that would be things like injections, enemas, IVs, what am I forgetting? Basically anything that really under state law needs to be performed by a registered nurse, a caregiver cannot do. And you really don't want them doing those things, right? Because that is not part of their training in most cases. So when it comes to medical type of activities, we want nurses to perform that kind of care. And that also includes medication setup. So we can talk more about that later if you have questions. They also don't perform heavy housekeeping. Most agencies will, actually we're required to follow a law stating that the caregiver cannot perform more than 20% of their, they cannot spend more than 20% of their shift performing housekeeping duties. And that basically is there to ensure that there's certain overtime exemptions that apply to caregivers in the home. So they're trying to basically, ensure that the person who is in your home is in fact a caregiver and not a housekeeper. Yes.
Is that insurance? Can you get insurance for caregiver?
Yes. So we'll talk about that in a moment. The liability issues. Is that what you mean? That kind of insurance? Yeah. Good question. Okay. So what are the qualifications of a caregiver? And I'm going to share with you the qualifications that we look for at our company when we're bringing people on board. And these are a few of our caregivers. I'm very happy. First of all, we look at prior experience working with older adults. That's important to us that folks come to us with some hands-on experience. They may have a certified nursing assistant certification, CNA, or they might not. The CNA program is a wonderful thing when people are able to complete it. There are waiting lists sometimes. It can be hard to get into those programs. And also, they don't tell the whole story because the amount of time that a person spends directly with clients in order to obtain the certification may be significantly less than a caregiver who's been working, as a professional caregiver for 5 years, 10 years, what have you. So I really encourage families to look at the whole picture when they're evaluating a caregiver and not get stuck on, do they have a CNA certification? We look for dementia care experience because a large percentage of our clients have dementia or some kind of cognitive impairment. Ability to lift, that comes into play obviously when you're helping someone transfer in and out of a chair or in and out of a car, but it also comes into play when they're carrying groceries into your house or putting a wheelchair into the trunk of a car. So whether you're working with an agency or hiring privately, which we'll talk about in a little bit, you want to ensure that this person has, some physical ability to perform the tasks. We're looking at personal care experience, and by that we mean actually providing bathing, toileting, dressing assistance. It is a more intimate type of task that you're helping clients with. It's different from strictly acting as a companion. The reason we look for this is because many of our clients age with us over time. And so even if they start off just needing a companion, we don't want to have to swap out caregivers if they start to develop a need for more hands-on assistance. So we really want everyone on our team to have this comfort level and expertise. Live scan background check, very important. Clean driving record. Professional references, we always check references, extremely important. And sometimes everything can look good up to that point. If any of you have been in a hiring situation or professionally, you know that that's extremely important if you can get information from previous employers. And then accurate information on the application. Do you have a question?
What's a live scan background check?
Oh, good question. So live scan is the type of background check that the state requires for caregivers to be on the registry. And we will discuss that in more detail, but it's essentially looking at federal databases and fingerprinting people. So there's lots of, when people say background check, it's important to find out, well, what does that mean exactly? Because it's verifying their identity as well as criminal history.
So that would, like you said, establish that you are Jane Doe, and then it would report on any crimes and
Convictions.
convictions.
Yes.
Okay.
Yeah. there's a lot of detail there, and there's also some limitations. You know, for example, it can look back a certain number of years, and so something that happened 20 years ago may not show up on the background check. It also looks at states of residence. So if a crime was committed, that person never lived in. You know, there are, that could be a whole discussion in and of itself. There are some limitations to the background check process, but this is what the state, you know, requires at this point and kind of considers to be the standard.
Excuse me, I have a question.
Yes.
So when you're interviewing someone who wants to be a caregiver and the life scan comes back with, you know, some negative things, do you cease right there as far as the hiring process? You don't hire that person, right?
Well, again, it comes to the state. I mean, regardless of that company's preferences or what have you, the state will not allow them to be on the registry unless there is a process where somebody can apply for an exemption. And so there are people employed by the state of California who look at each of those cases to determine if an exemption is warranted. So you cannot legally, as a licensed home care organization, you cannot legally hire a caregiver who is not qualified to be on the state registry. Yes.
Now, if a person leases from some part of the place, elderly person, and the landlord gets a lengthy lease, but the landlord is abusive, neglectful, and caregiver for the person sort of stuck with this long lease, and a person who's not a caregiver, but is a caregiver. Your landlord's a caregiver in a way. They make, they turn the lights, they gotta they have jobs to do that affect your care. If your garage door doesn't go up and down and you don't fix it, like an elderly would be out there pushing your heavy good door up and down and could get injured. A surrogate caregiver of sorts.
I don't think the law would see that way, in my experience. Older adults are afforded certain protections as consumers, but also in a criminal sense. You know, there's a lot of law around elder abuse and financial abuse of elders. In my opinion, no. You have a business relationship with them. I'm not an attorney, however. Let me just say that if you do feel that you have a legal claim, you know, because the laws around tenancy and landlords are quite complex. But if you were concerned about that, you could always go to an elder law attorney and say, hey, I'm an older person, I'm in a business relationship where I feel like I'm being taken advantage of. Here's the scenario, and they could give you some feedback.
Or just go visit the landlord with your 2 German shepherds.
Okay, no comment on that. Okay, so the big question that people often have is how do you pay, who pays for the in-home care? And when we had our last session, we spent a fair amount of time talking about how does long-term care get paid for in general. So we'll just kind of briefly discuss that now. The big one is that Medicare does not pay for care that it considers to be custodial or not medically necessary. And those are Medicare terms. And it basically means if that person doesn't require skilled care, and remember that's care that has to be provided by a nurse or a physical therapist. We're talking about just daily help. They don't consider that to be medically necessary. Therefore, not covered by Medicare, which is a health insurance. Long-term care insurance will pay if your policy covers in-home care. Not every policy does. So again, if you or a loved one has a policy, it's very important to look at the terms to see, does it apply to facility care. And that is even broken down further into skilled nursing versus assisted living. And does it cover in-home care? Private pay. That is what many, many people end up needing to do because they don't have a long-term care policy, or they don't meet criteria for some of these other programs that are available. One of which is the Veterans Aid and Attendance Program. So for certain folks who are have service-connected disability, they can apply for aid and attendance through the VA. There is an income component to it and also the connection of your disability to the service. So some people can get a lot of help through this program where it can help pay for care at home as well as care in a community assisted living community setting. There are also some great nonprofits here locally that have received grant funding to provide respite care. For example, Southern Caregiver Resource Center is a wonderful nonprofit here with the office in Kearney Mesa area. And they do offer some respite care to family caregivers so that they can have some time to go to a support group or go to a class. So this is something that you can find online, or if you work with a hospital social worker or a care manager, you can get connected to some of these programs. Medi-Cal for people who are recipients of Medi-Cal, which is the public health insurance paid for by state of California and the federal government, they can access a program called In-Home Supportive Services, IHSS, here in San Diego. And basically, a family member can be paid to take care of that person who needs assistance, or the program will cover a non-family member who is hired to care for that person. This does not cover 24-hour care. So there are some limitations in terms of how many hours can be provided. It can also be quite a challenge for the care recipient if they're directing the care, because in some cases, some individuals don't have a family member, and that's why they're accessing that program. But then they are actually the person hiring those caregivers and overseeing them and having to find another person if that person gets sick. So it can be, it's a godsend in many ways for folks because they can get a family member paid to help them who otherwise might be at work, at an office. But it has its limitations. The average cost in San Diego for in-home care is $28 an hour. That's through the Genworth cost of care study that we talked about last time. But you can certainly find care that is more expensive than that. That's, I think, getting a little bit on the lower end, frankly, because the minimum wage continues to rise and the cost of running a home care business continues to rise in terms of workers' comp insurance and so forth. So, but this is a figure that you can kind of have in your head as you think about your budget and the person that you're caring for. So the big decision that people have to make when they're looking for in-home care is whether they're going to work with an agency or if they're going to go the private caregiver route. So let's talk about that for a couple minutes. I think I've already described some of the benefits of working with an agency, but basically an HCO, let me go here, I'll come back to the other two, is a licensed home care organization. To be licensed by the state, we can only hire caregivers who are on the registry. Okay, so remember, they have to be live scanned, they have to go through training. The agency is required to work with you to establish the schedule It's a collaborative effort. We must provide home care aides with paid sick time. We are required, obviously, to respond to your questions and concerns. We have to be insured and bonded. And we are subject to civil penalties or revocation of our license if we don't comply with the law. So there's a lot of skin in the game for an agency to make sure that your experience as a consumer is a good one, right? All right, so TB testing is part of the onboarding process. Agencies provide supervision in some form or another. We manage tax issues, insurance issues. So if a caregiver is injured on your property, but they work for an agency, that is not your problem. That is the agency's problem to deal with. If a caregiver becomes ill and needs to be off for a week or a month, the agency works with you to restaff, to make sure you have somebody there to help you. If there's ever a concern, maybe there's an awkward conversation that needs to happen, like, I really like my caregiver, but she wears too much perfume and it's driving me nuts. You don't have to have that conversation. That's up to the supervisor, the agency. And that's a relatively mild one, but you can imagine there's a lot of scenarios that can come up. And then if, let's say you go into the hospital or the ER and they say, you know what, you need 24-hour care for the next week. The agency can ramp up and provide that. Whereas a private caregiver has limitations, right? They may have other things they need to do and they can't be there 24 hours a day. Some people choose to hire a private caregiver because they can perform functions that a licensed HCO, home care organization, cannot perform. So remember we were talking about invasive care. There are some folks, for example, people who have paraplegia or quadriplegia, they require certain care, assistance with bowel and bladder, that a licensed home care organization cannot provide under its license. So they may, in essence, if they want to live in the home setting, they kind of have to hire a private caregiver unless they can afford to pay for an LVN or an RN to help them, which is extremely costly to do that every day. So the expense, you can hire a private caregiver for less than $28 an hour. We're going to talk about what you get for that $28 an hour, but for some people, it's just simply not possible to pay what an agency is asking. And then we've heard from some clients, they value their privacy. For example, some people who may be well known in the community or are concerned about just details of their private life, so I have heard that from some clients that they prefer to work with somebody who they consider to be their own employee. Okay, but before you go down that road, and I have seen that work, by the way, especially when there's a family member who is a business owner, for example, who is skilled in hiring and supervising employees. I've seen that arrangement work, but there are some considerations before you go down that path. Potential for abuse. We'll talk more about that. How does that happen? What does that look like? There is liability for the client, especially if you have a caregiver living with you. You brought up landlord and tenant issues. You are a landlord if a caregiver lives with you, and therefore there's all kinds of laws around. Let's say you decide you don't want them to live with you anymore. Then you're essentially going through an eviction process in some cases, so it can get quite complicated. Most family caregivers, families who hire a private caregiver aren't asking for a TB test, for example. So you don't know a lot about the health of that person coming into your home. And no replacement may be available if they need to fly to another state to care for a family member, what happens to you? Who's going to step in? And then these boundary issues can be a lot more subtle than what you might consider to be abuse, but they can cause problems. So if the caregiver says, you know what, my childcare fell through today, can I bring my kids to work with me? Not an uncommon request, actually, but how are you going to handle that as a private employer? Some clients that we've worked with, find that to be a very awkward situation. They have a lot of empathy for their caregiver. They understand if they don't have childcare, but they really need them to come, but they don't really want kids running around their house. But so what do you do in that situation? It can be really challenging.
Well, Susan, and also, like, if they bring their children and their children have an accident in their home,
Yes.
that's really bad.
There's a lot of, sorry, I kind of skipped over that liability a little too quickly, didn't I? That should be underlined and bolded. There's so many different things that can happen in the home. Things can go missing, people can become injured, they can be in a domestic violence situation and now their partner is coming to your house looking for them. I mean, the list is long. So
Things that go missing in these care places, institutions, I see.
Mhm. Assisted living or nursing homes?
Nursing homes.
Uh-huh.
Things that go missing in those
Yes.
places.
Yes. Unfortunately,
Quite
yeah.
easily.
Mhm. The comment was things can go missing in nursing homes also.
Skilled nursing homes.
Yes.
They're skilled at taking something.
Sadly, that is true. So we talked about a licensed HCO. The registry is the state, operated list basically of who can work for a licensed home care organization. You can Google State of California HCA Registry. If you have the identifying number for your caregiver, you can look them up and make sure that they are in fact on the registry.
Mm.
And they are registered for a period of 2 years at a time. Incidentally, this is Shelby. She is a Windward employee who started with us as a caregiver. She now is a registered nurse and is a care manager with us. So really exciting for us to have somebody kind of come, to support her in her education and then have her come back to working with us in a different capacity. All right, so let's talk about elder abuse. The reason we talk about this with home care is we need to talk about it, again, with any type of care provided to older people. But when you're receiving care in your own home, it is frequently just you and the caregiver, right? So a little bit different from in a facility type setting where there's different people laying eyes on the client or interacting with the resident. And so it can create a situation where there's just not somebody there all the time overseeing what's going on. So abuse is a concern, and an older person can also feel quite dependent on their caregiver, which can create this sort of power differential and also prevent that person from reporting abuse. Abuse can show up as physical, in a physical form, so that would be, obviously if someone has bruises or is sort of unexplained injuries, that kind of thing. Emotional, that's how does the caregiver talk to that person? Are they respectful? Are they respecting good boundaries? Financial abuse can take many forms. Using a client's credit card without asking, identity theft is a concern. You know that the Medicare cards do not have your social security number on them. And that's one of the reasons is because, it was such an easy way for people to obtain your social security number, apply for credit, your name, so forth. Sexual abuse, sadly, this is an issue that frequently will come up in facility settings as well. And then neglect is basically just not providing for that person's basic needs. So not providing enough food, not helping them bathe, or isolating them from other people. Anybody can be a victim. Anybody. Okay, so that means even if you are cognitively 100% or physically able, there are people who sadly seek out caregiving roles because it gives them access to older people. And that would be what is typically called like a predatory elder abuser. So that's somebody who intentionally goes into a situation with the goal of either financially exploiting that person or otherwise, having that control. There are other situations that occur where a caregiver does not go into the situation thinking I'm going to take advantage of this person, but there may be a change in their life circumstance where they feel desperate, like they have a sick relative or their car broke down and now they have no way to get to work. Different things that can happen that can sort of push somebody to do something that they may not otherwise do. And I'm not saying that as an excuse for what they do, but just simply to distinguish that there are the people who go into it with an agenda of taking advantage of older people are particularly worrisome. And they are out there. And I think that to me is one reason to work with an agency, because there are those protections involved with an interview process, the background check, the supervision, to stop those people.
How do you stop it? Once it's started, who's the police?
Who's the police and how do you stop it once
How do you
it's
stop
started?
it? They signed a long-term lease and they are being victimized. And
Well, I can't speak to the landlord, tenant situation, but if elder abuse is occurring, home care employees are all mandated reporters of elder abuse. So the first thing we would do is get that client to safety. So frequently it's a family member who is the perpetrator of abuse. Sadly, that is the most common scenario, actually. And so we will work with the responsible party to move that, the victim, the older person, to a safe environment. But then we get the county involved, and that includes law enforcement. And we, it's a crime. Elder abuse is a crime. So it is followed up on in that way. And it can be complicated, especially with the financial abuse. I'm sure the folks here at 1 Degree can attest to that when you have accounts in different places and different people accessing, it's a big project to address that. But
Susan, isn't it true that you're more likely to suffer from financial elder abuse in the home than at a facility?
I don't know. I haven't seen data on that.
I think I've read that because just statistically, there's more people staying at home and getting care.
Well, that's true. Just the sheer numbers of people.
I think a lot of people think, ooh, if I go to a facility, I'm going to be a sitting duck, when you're a sitting duck in your own home.
Well, certainly who here has not received these phone calls, right? From, we're the fireman's retired fund collecting. And some of those are legit, right? But many of them are not. And there's many mailing lists circulating that people pay big money to access older adults. Many older adults are lonely. They will talk to the person on the phone, whether they know who they are or not, and they will reveal personal information. So just even those scams, the phone calls, the emails, I need help, I can't get out of such and such country without your assistance. The sweetheart scams. I went to a whole presentation on this by a US postal inspector who talked about these elaborate international elder abusers who basically look for people on dating sites, older adults, and they become, interested in them, and they have this online relationship, and the person is sending money to this person they've never met, but they get pictures. And it actually overlaps with identity theft, because in this particular situation, they stole the identity of some other person online. So they got this poor innocent guy involved using his photographs and his biographical data, and posed as him basically to court the targeted victim. So yes, it's at home. It's in facilities too. Different things can manifest in different settings. The most vulnerable people are those who are nonverbal for obvious reasons. They can't pick up the phone and say, hey, I need help. People with cognitive impairment, even mild cognitive impairment, can be taken advantage of. Again, you're looking at the con artist people are extremely good at what they do, and they can identify weaknesses very easily. Physically dependent, again, if you are afraid that you will not be able to get out of bed tomorrow if you fire that caregiver, that's not a good feeling of being dependent. If you've been previously abused or victimized, they say this about child predators as well, that they can identify victims who have been victims. And it's just sort of sensing that vulnerability in other people. And then again, people are recently bereaved. If they've lost their partner, their husband, their wife, again, very vulnerable. And so if somebody then befriends them, becomes more than a friend, they're lonely, they're sad. So again, anyone can be a victim, but there are certain people who are more vulnerable. We're almost out of time, so just very quickly, there are ways to identify if abuse is occurring. So kind of signs to look for: the person receiving care is withdrawn and fearful. There's unexplained marks on their skin. If the caregiver is sort of like keeping other people away or doesn't leave the room when you want to visit with your loved one. The person who's receiving the care is showing preference for the caregiver over family members or friends who used to be very dear to them. Again, that's sort of that isolation that can occur. If the caregiver is putting his or her own needs over those of the client, so they're running errands now for themselves when they're on the clock for the client, bringing them along in the car to get done what they need to get done. Or the client's insisting they're in love, ignoring the concerns of family and friends. It can be very powerful. And so watch out for that. So just to wrap up on a positive note, there are many steps that you can take to ensure a good experience in the home. And again, I want to emphasize, I could write a book on the number of success stories, that I have seen over the years when it comes to home care. People living in their own homes until they die, with care, surrounded by people who are trained and compassionate, and staying in the place that is most important to them. So these are my recommendations, that you work with a reputable, licensed home care organization. And I do have handouts here from the state of California that explain a little bit more about HCO licensure and what caregivers can and can't do. So I encourage you to take those. Make sure, if you have an advocate, whether it's a friend or family member, get them involved in the process, because 2 sets of eyes and ears is always better than one, right? Compare notes after you interview agencies or after you meet a caregiver for the first time. What did you think? talk about it.
You
should-
can't come in here. You can come in here, but you can't come in.
You have to decide who you're comfortable having in your home. You need to agree on a plan of care. So this is collaboration. It's not the agency telling you what's going to happen. You know, together you work out what are the responsibilities of that caregiver. You should insist that there's some kind of documentation in the home. So if the caregiver is supposed to be doing help with transfers, meal preparation, taking that person to the barber twice a month, shower 3 times a week, it should be written down so you can hold them accountable to the plan of care. And also there's clarity about what they're supposed to be doing and not doing. There should be regular visits from a supervisor and family if available, including unannounced visits. Know the signs of potential abuse or undue influence. And this is where it can be quite subtle. Again, sort of this caregiver, if you have a feeling like, ooh, something doesn't feel right about this, or how did this caregiver get to be so influential in this situation? Trust your instincts, look into it further. And then address any concerns right away. So I really need to emphasize that if, let's say a caregiver does bring a pet to work or a child to work, it might be embarrassing to confront that person, or you might think, well, you know, it's just one time, it's not the end of the world. You need to be clear about your expectations, because if you don't set a limit, it can happen again, right? And it can become a slippery slope. So those good boundaries are really critical to this relationship going well. Remove valuables. Obviously, when you have anybody coming into your home, you need to be really mindful of, or put them, you know, in a safe place, meaning locked up in a safe. Remove firearms, and that is for your protection as well as the caregiver's protection. Again, when we're dealing with dementia and firearms, for example, that's just not a good combination. You want to keep controlled substances like medications in a secure place, because that's another way that, unfortunately, things can go awry if a caregiver is helping themselves to a client's Xanax or Vicodin, for example. Guard your personal information. I mean, I've done home visits where clients have their financial statements lying out all over the house, Social Security information. You know, again, it's just sort of using good practical sense. And if you're helping the person who's receiving care, you may have to sort of take a firmer hand when it comes to that. And, oh, you know, like, you know, my family member, when I brought that up, said, "Oh, it's fine. You know, it's I put a sheet over it when they come over." I said, "Well, that's not going to cut it. I'm sorry. We need a better plan." And then again, just, you know, you should insist upon professional boundaries. In a perfect world, you're going to feel like that caregiver is a member of the family as far as the care and the concern that they show for you, but they are not a member of your family, okay? You are an employer or a client, and they are there to provide a service. So, you know, that saying, good fences make good neighbors, very similar. You know, clarity about boundaries helps you, and it also helps the caregiver, because they have certain rights as an employee. And it's important for us to remember that too, that, you know, they are entitled to work in a harassment-free environment, for example. So we have an obligation, we have many obligations to them as employers, whether it's the agency who's the employer or the individual client, but they also have obligations as employees or the person providing the care. All right, that's it. This is my contact information. If I can be of any assistance to you after this, please let me know. Yes.
Okay, so you've identified the needs. You need someone to come into your home to care for parents.
agree on a plan of care.
Mhm.
So how does that process, what does that process look like, and what does it actually, when do you start spending money to pull this plan together?
Okay, so I'm gonna assume you're working with an agency, okay? Every agency will have some mechanism for that. So some agencies will say, we'll come out and provide a free consultation. And so essentially what they're gonna bring in most cases is a checklist. And they're gonna ask you, does your loved one need help getting in and out of bed? How much help? You know, can they assist 20%, 50%, 80%? So they're gonna go through all the ADLs with you. Then they're gonna ask about dementia or cognitive impairment. They're gonna ask about recent falls, recent hospitalizations, medical conditions, you know, just kind of an overview of that person's health and then what you think the needs are of that person. Ideally, that's gonna happen with the client, the care recipient, present, or some part of that assessment should include a face-to-face with that person, because sometimes the family member will frankly not know, you know, what the person's current capabilities are, or they might overestimate what that person's able to do. So having some kind of face-to-face with the care recipient is important. And the agency, you know, sometimes they'll send an office staff person to do that. Sometimes they'll send, if they have an RN on staff. At our company, we send out a care manager, so that's a master level social worker or an RN to meet with the family initially and the client. And then we will bring our expertise to the table. So, you know, many agencies have worked with hundreds of families over the years, so they know, you know, in this situation with this diagnosis, most people need, for example, supervision. They haven't wandered before, but you know, you need to think about that. They're now in the moderate stages of dementia. Is it safe to leave them when you know, are out of the house for 3 hours? So we're bringing our expertise and giving you some input from our standpoint. And then together you agree on what is the caregiver's piece of that. You know, what is the family gonna do? What is the caregiver gonna do? And then you write it down, everyone signs it, and that's the plan. And the plan can change, of course. You know, if the person, let's say they're coming home from the hospital after a medical event, once they get home, it might look different than everyone thought it was going to look like. So it's constantly being tweaked, you know, as that person's condition changes.
And the care manager, is there a different fee for that service than there is for the actual in-home care service?
Yes, so first of all, not every home care company has care management as a offering. Our company charges $150 an hour, which is pretty standard in this area. So yeah, that's an important question to ask when you're interviewing agencies. If you feel that you need a sort of extra layer of assistance and coordination and expertise, you might want to look at companies that do provide care management. Or if you, let's say, you know, we've had many families where there's a retired nurse who's in charge, you know, the family member in charge. So they may feel that they can fulfill that kind of role. It just depends on the situation. Yeah.
So you hear these stories, and if you have long-term health insurance, okay, and you need to hit the magic 3 ADLs or whatever, those things that line up. I've heard that it's very tough to get those checked off so that you can get the benefit that you've been paying for decades. Can you comment on that?
Yes. There's a couple different factors. One is doctors have to sign a form to get the claim started. Many doctors have never seen this form before, or they're not familiar with it, so they don't kind of understand that there are key things that need to happen on that form. So sometimes it's just a matter of educating them, like, hey, you know, my policy does not go into effect unless you indicate that this person with dementia requires supervision. You know, and so sometimes it's just a matter of educating them about the form that they're filling out, and we're not asking them to falsify information. It's
Is this
just
a standardized form,
each
statewide or federal?
no, it comes from the insurer.
Oh,
So Jen Word or
They
John
should, seems like
Hancock.
they should have told you that. That you needed to do that.
Well, until you
Sure,
go
I
and
mean-
claim, they
Right.
usually don't give you all of that.
Yes,
Yeah.
yes.
You know, some companies are not very good at, I mean, they're disincentivized. I have a care manager working with him, and I mean, she made multiple calls to the insurance company before we got the claim off the ground. Since it's been off the ground, it's been relatively smooth sailing, but the getting it started
You gotta be persistent.
quite challenging. Yes.
Maybe even intimidating.
We do have a local resource here that if you're in that situation, I can give you somebody whose whole business is helping people go on claim and then helping them manage the long-term care process. They're intimately familiar with all the companies and how they do things, and
We're not there, but I've just heard those stories of a friend of mine's taking care of, getting it going for his parents. He said it was a nightmare.
yes, sadly,
A lot of money out, already paid out when there should
Trying
have
to
been,
help out.
the benefit
yes.
should have been in place.
Yeah.
Great.
Thank you for coming. I don't want to, if people need to go,
Take
please,
care, Dawn.
I'm happy to stay if anybody has individual questions, but I know we're past 1 o'clock, so.
Final remarks? Yeah, good. No, I think we're good. I mean, you guys have been here before, so thank you all for coming. And I think we'll have part 3, which is taking care of mom, we'll take care